The things I'm fascinated about, because beauty is in fact in the eyes of the beholder. Nobody will say that the same person, you know, if you ask 20 people, they would pick the same person as beautiful out of a lineup. If there were 20 beautiful people, everybody would have a different choice. How would someone know, for instance, it wouldn't strike me that if I knew I wanted plastic surgery and I wanted to look better, how would I know that cheek implants would make me look better? Wouldn't be the first thing that would come to my mind.
But that was part of my point, because this is what a complete examination or evaluation of a face entails. Now, I never say to patients, come in to the office and have your cheeks done or have your ears. I mean, talking about stories, there are patients who may come in with protruding ears, like a taxi cab with open doors or antenna ears, you know, and then they're not there to have their ears fixed. And the worst thing you could as a plastic, oh, you're here for me to take care of ears. They may be there to have a small hump on their nose fixed, because and that's the patient's right and prerogative. So we don't come around and start suggesting, at least I don't in my practice. But there are many, many patients who come in and say, you know, I don't know why I look a little more tired than I used to. I don't necessarily feel tired, but I look in that way. Would you be kind enough to just look at me, analyze my face? And oftentimes the early signs of aging come in the middle third of the face, not the forehead, not the neck necessarily, but it changes from patients to patients. So then if the patient solicits this kind of opinion, then I think our eyes that are trained with, you know, through experience, and likely that those of us who've gone into this field have somewhat of a refined aesthetic sense, then we would be go ahead and analyze.
That's the key thing that you hit on. It's a refined aesthetic sense. And at the end of the day, there are a lot of people who probably can technically move the skin from here to there, but knowing which skin to move or when to put the implant or when not to do the surgery, that's what you're really paying a surgeon for, in my judgment. You know, a lot of guys are technically great, but they overdo it. It's interesting because there are several things that I think are universally thought to be attractive, like high cheekbones. You see a model and you comment that she has high cheekbones, or the full lips after someone, you know, the Goldie Hawn phenomenon from the First Wives Club, or full breasts are thought in general to be attractive, but you can overdo those things. So let's talk a little bit about the lips first of all.
Now, before we go to lips, let me pick up on a point that you made, and I think it's a very good one, about aesthetic sense. It's not only in evaluating patients, but when you operate on them. Let's use a facelift for an example. Some parts of the face, again, let's think about the upper, the middle, and the lower, being the neck. Some parts of the face, especially some patients, lend themselves much more readily to pulling and tightening than other parts. Now the surgeon,
right, and we don't want to get that wind tunnel look.
Yeah, well, wait, Jerry. But the patient, the surgeon with a good aesthetic sense will not fall into the trap where he will pull the part that's very pullable, so to speak, and not be able to get the other parts of the face in harmony. See what I'm saying?
Yes.
So it's very important, the aesthetic sense, and say, look, you know, this is about how much I can accomplish globally for the face. This is what I'm going to do with this. So the technical ability is far from being sufficient. It's important, but you also need this aesthetic sense. Now,